Hey guys, I just wanted to share with you an interesting running patient that I have been training who is preparing for the Sydney Marathon. Now, he has a meniscus issue, which we've been training for a few weeks, and he'd actually been going really well. In fact, he'd been getting his long runs back up to roughly around like 30 kilometers. And so we're just checking in every so often. And then 1 week after one of his long runs, he had a bit of a flare up in the knee. Hadn't really done anything different other than increasing the distance. So I got him back up onto the treadmill to have a look at his running technique again. And what we found was that his injured side, his foot was just a little bit more turned out than the other side. Now, in and of itself, the foot turned out is actually fine. However, it was obviously different to the other side. If both of them were the same, I wouldn't think anything of it, but that injured side was slightly turned out. I got him to have a lie down on the bed, and then you could see just lying down on his back, his foot again was slightly turned out on that side. So we checked his hip range of motion, and sure enough, he had that limitation in the hip. So luckily, a little bit of hands-on treatment fixed that up, which number one told me that it wasn't anything major structurally going on in the hip joint. Number two, he could actually replicate that at home, and then he could concentrate on that during his run. And since then, he hasn't had any flare-ups, and he'll be cracking onto the Sydney Marathon in a couple of weeks.